Hey everybody, welcome to the Anesthesia Surgical Hub. You know, going in for surgery is a big deal. It's natural to have questions and maybe feel a little nervous, right? And sometimes those nerves come from hearing things about anesthesia that might not be entirely true. So today, we're tackling those anesthesia myths head on. We're going to break it down, make it easy to understand, and hopefully put your mind at ease. You know me, I like to keep things light and fun, but this is serious stuff. So let's get to it. Okay, let's just address this one right off the bat because it's a biggie. You're going to hear me say this a lot. Modern medicine is amazing, and nowhere is that more true than with anesthesia. These days, anesthesiologists have all sorts of techniques and medications to make sure you're completely comfortable before your surgery even starts. Think of it like falling asleep. Really, really fast. 1 minute you're chatting with the nurses, and the next thing you know, you're waking up in recovery. No pain, no discomfort, just peaceful sleep. Of course, everyone's different. So your anesthesiologist will talk to you beforehand about the best approach for your specific needs and medical history. And hey, if you're someone who gets a little anxious, don't worry. They're pros at handling that too. They can give you something to help you relax, so you're calm and comfortable throughout the entire process. It's all about making sure you have the best possible experience. Okay, this one's just plain scary, and thankfully incredibly rare. I mean, it's like winning the lottery backwards. The odds are definitely not in its favor. But seriously, anesthesiologists are highly trained medical professionals. Their entire job is to make sure you're safe and sound throughout your entire surgery. They use sophisticated monitoring equipment to keep track of your vital signs, your heart rate, your breathing, all that important stuff, every single second. It's like having a personal bodyguard for your body while you're under. Plus, they're right there with you the whole time, carefully adjusting the anesthesia as needed. They're like the pilots of your surgery, making sure everything goes smoothly from takeoff to landing. So rest assured, the chances of you not waking up from anesthesia are incredibly slim. You know, I wish I had this excuse sometimes. Sorry, I forgot to pick up the dry cleaning. Must be the anesthesia from that toe surgery 5 years ago. But alas, it doesn't really work that way. While it's true that some people might experience some short-term memory fuzziness after anesthesia, it's usually temporary. Think of it like that feeling you get after a really long nap, a little groggy, a little disoriented. Maybe you can't quite remember what day it is. It's the same kind of thing. And just like with a nap, those fuzzy feelings fade away pretty quickly. Now, it's important to note that everyone reacts to anesthesia differently. Some people bounce back right away, while others might take a little longer. Anesthesia is dangerous. When you're older, getting older is a privilege, not a punishment. And just because you've got a few more birthdays under your belt doesn't mean anesthesia is off limits. It's true that as we age, our bodies might need a little extra TLC, and that includes how we respond to anesthesia. But here's the thing. Anesthesiologists are experts at tailoring anesthesia plans for people of all ages, including older adults. They take into account your overall health, any medications you're taking, and any pre-existing conditions to create a safe and effective anesthesia plan just for you. It's like going to a really good tailor. They take all your measurements to make sure you get the perfect fit. So if you're an older adult facing surgery, don't let this myth keep you from getting the care you need. No food or drink for days after anesthesia. Okay, I don't know about you, but the thought of not being able to eat or drink for days is just... no. Thankfully, it's another one of those anesthesia myths. In most cases, you'll be able to sip on some water and maybe even have some crackers pretty soon after you wake up. Of course, your doctor will give you the all clear based on the type of surgery you had and how you're recovering. But generally speaking, you won't have to wait long before you can enjoy a nice meal. And let's be honest, hospital food isn't always the most appetizing, so you'll want to get back to your own kitchen as soon as possible. Anesthesia is only for big surgeries. This one's a little like saying you only need a haircut if you're going bald. Anesthesia isn't a one-size-fits-all kind of thing. It's used for all sorts of procedures, big and small. Think of it as a way to make you comfortable and pain-free, no matter what kind of medical intervention you're having. Whether it's a minor outpatient procedure or a major surgery, your anesthesiologist will work with you to determine the best type and level of anesthesia for your specific needs. Sometimes it might be general anesthesia, where you're completely asleep, while other times it might be local anesthesia, which numbs just a specific area. This one's definitely the stuff of nightmares, right? Waking up in the middle of surgery is nobody's idea of a good time. But thankfully, it's about as likely as running into a unicorn on your way home. Highly unlikely. Remember those awesome anesthesiologists we talked about? Well, part of their superpower is their ability to carefully monitor and adjust your anesthesia levels throughout your entire surgery. They're like those amazing air traffic controllers, making sure everything stays on track and everyone stays safe. So, you can relax, knowing that they've got you covered, literally. You can rest easy, knowing you'll stay comfortably asleep, or numb, depending on the type of anesthesia, until your procedure is over. This is like saying everyone wears the same size shoe. We're all unique individuals, and our anesthesia needs are just as unique. That's why anesthesiologists are like detectives. They gather as much information as possible about you before your surgery. They'll ask about your medical history, any medications you're taking, any allergies you have, even your lifestyle habits. It's like putting together a puzzle, with each piece helping them create a personalized anesthesia plan just for you. This ensures that you receive the safest and most effective anesthesia possible, tailored to your individual needs. So don't be shy about sharing all the details with your anesthesiologist. They're your partners in making sure your surgery experience is as smooth and comfortable as possible. Okay, let's clear the air on this one right away. While it's true that some anesthesia drugs can have addictive properties, it's important to remember that context is everything. When used appropriately in a medical setting, by highly trained professionals, the risk of addiction is extremely low. It's like saying that because water can drown you, you should never drink water again. It's all about using something safely and responsibly. Anesthesiologists are experts in their field, and they use these medications judiciously and with great care to ensure your safety and well-being. Anesthesia only comes in injection form. You know, anesthesia is a lot more versatile than people give it credit for. While it's true that some types of anesthesia are administered through injections, there are other methods as well. Remember those gas masks they used in old movies? Well, that's actually a form of anesthesia called inhalation anesthesia. It's often used for children or for procedures where an injection might not be ideal. And then there's regional anesthesia, where medication is injected near a cluster of nerves to numb a specific part of the body. Regional anesthesia is as risky as general anesthesia. This is like comparing apples and oranges. They're both fruit, but they're very different. Regional anesthesia and general anesthesia are two different approaches, each with its own set of benefits and risks. Regional anesthesia, like epidurals or nerve blocks, numbs a specific part of your body while you remain awake. It's often used for procedures on your limbs, like a knee replacement or a hand surgery. General anesthesia, on the other hand, puts you completely asleep for the entire surgery. The best approach for you depends on a variety of factors, including the type of procedure, your overall health, and your personal preferences. Your anesthesiologist will discuss all the options with you and recommend the safest and most effective approach for your specific situation. Anesthesia always makes you unconscious. Remember how we were talking about anesthesia being like a versatile wardrobe? Well, it's got an outfit for every occasion. While general anesthesia does put you completely under, there are other types of anesthesia that don't make you unconscious. Think of it like this. General anesthesia is like hitting the off switch on your consciousness, while other types are more like turning down the volume. You might be awake and aware of your surroundings, but you won't feel any pain. This is especially common with regional anesthesia, where you can actually stay awake and even chat with your surgeon during the procedure. Of course, if you'd rather take a little nap, they can always give you something to help you relax. It's all about what makes you feel most comfortable. So there you have it, folks. We've tackled some of the most common anesthesia myths out there. Remember, knowledge is power, and understanding the facts can go a long way in easing your anxiety and making your surgery experience a positive one. Don't be afraid to talk to your doctor or anesthesiologist about any concerns you have. They're there to help you every step of the way. And hey, if you found this video helpful, be sure to give it a thumbs up. Subscribe to our channel for more informative content and share it with your friends. Because everyone deserves to feel informed and empowered when it comes to their health.